Occupational English Test. Listening Test. This test has 3 parts. In each part you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a cardiologist talking to a patient called Mr. Stephen. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, Mr. Stephen. What brings you in here today?
Hi, I have this pain in my chest. It is really bothering me. I don't know what's wrong.
Okay, I understand. I need to know few things. I would like to ask few questions. Firstly, where is the pain exactly?
It's just right over here on the left side of my chest.
Okay, and when did this pain start?
It started just 30 minutes ago. It came on while I was just shoveling the driveway.
Okay, and has that pain been getting worse at all over the last half an hour?
No, it just came on suddenly and I'm sorry. Yeah, the pain has been there this whole time and it's gotten worse ever since it started. I have never experienced anything like this before. It is dull pain and I feel like there's a lot of pressure on my chest.
Okay, and is the pain just staying in the region of the left chest area that you mentioned, or is it traveling to any other part of your body?
No, I'm kind of just feeling it right here. On the left side.
Okay, is there anything that you do that makes the pain either get worse or go away or like get better?
I think it's a bit worse if I'm moving around or when I was walking in here. I think it made it a bit worse, but nothing has seemed to make it any better since it's starting. I think it's a little bit worse when I'm laying down.
Okay, and other than the pain that you've been having, have you been having any other issues?
I felt a little bit short of breath since the pain started. And I want to say that I play rugby and was tackled by another player yesterday. But my chest felt fine after that.
Okay, have you been traveling at all recently?
You know, I like to visit places and been a global traveler since my childhood. But for the past couple of years my hands are full. I work as a business development manager. And didn't travel anywhere.
Okay. Just a few more questions. Have you had any diagnosis made by any physician like diabetes or high blood pressure?
Yeah, I've been told I have high cholesterol and high blood pressure. I do take medications for both blood pressure and cholesterol, rosuvastatin and lisinopril, and I take a multivitamin.
Okay, and how about your diet?
Usually I feel like it's fairly balanced overall. I might eat out a little bit too often, but try to eat as many vegetables as I can. I love apples and eat fairly regularly.
Based on your symptoms, Mr. Stephen, I would like to perform some diagnostic tests to understand the cause of your chest pain. We'll start with an electrocardiogram to check your heart's electrical activity and a chest X-ray to look at your lungs and chest structure.
Okay, doctor.
We'll also run some blood tests to check for cardiac enzymes that might indicate a heart attack and to assess your cholesterol levels. In the meantime, let's get you some oxygen to help with your shortness of breath.
Thank you, doctor. That sounds good.
Once we have the test results, we'll have a clearer picture of what's going on. Based on your history of high blood pressure and cholesterol, we need to be cautious. If the tests show that your heart is involved, we might need to take further steps, like a stress test or even an angiogram.
End of extract 1. Extract 2, questions 13 to 24. You hear a pulmonologist talking to a patient called Mr. Peter. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
How may I help you today, Mr. Peter?
Yeah, I've had this cough and it's just not going away.
Okay, and can you talk more about your cough?
Sure, I think it started about a month ago. I'm bringing up some phlegm and it looks pretty dark and sometimes red. It does kind of look like blood, so that's what scared me and wanted me to come in today. I'd say it's kind of like it's a stabbing kind of pain, and I only really notice it when I take a deep breath.
Okay, I see. And how much phlegm would you say you're putting out like per every time you cough?
I'd say every time I cough, I'm bringing up at least a teaspoon of the dark sputum. When it comes to cough, it's there pretty much all the time, but especially bad in the morning. And, I remember, I had a cold a few weeks back, but it was just a runny nose, and it seems that the cough has been kind of lingering around.
Okay. And do you find that it's been getting worse at all?
Yeah, the cough has been getting worse.
And have you had any previous episodes of this?
Well, I've had a smoker's cough now for several years, but it's really just this past month that it's gotten really bad, and I have it all day long. Now I am coughing daily, and nothing that seems to really make it any worse or better.
Okay, and do you have any other symptoms like shortness of breath or runny nose, sore throat, anything like that?
Nothing I can think of, just this cough that's been bugging me.
Okay. And have you traveled outside of the country at all recently?
Yes, I've been working in the Philippines for the last 3 years.
And have you been experiencing any fevers or chills or night sweats?
I felt like a little bit hot. I might have a fever now, so yes, no chills though. I have been sweating more at night too. I have to get up and change my pajamas sometimes. And sometimes the sheets. I had to do this, maybe a couple of times per week. Also, my energy has just been really down. I've been really fatigued. I want to say one more thing. I'm down like 15 pounds over the last few months, and I haven't really made any changes to my diet or exercise, so I haven't really been trying.
And have you previously been diagnosed with any medical conditions?
Yeah, just a chronic bronchitis with a smoker's cough. I take a beta agonist inhaler, an inhaled corticosteroid.
What about your job? Can you tell me a bit more about your work and environment?
Sure, I'm a construction worker. It's a pretty physically demanding job, and I'm exposed to a lot of dust and sometimes fumes.
Thanks for that. Based on what you've shared, there are a few possibilities we need to consider. Given your history of smoking and your symptoms, I'm concerned about conditions like chronic bronchitis, or even a more serious condition like tuberculosis, especially since you've been working in the Philippines where TB is more common. We should also consider other lung infections, or even occupational lung diseases given your job exposure.
But that sounds serious.
It could be, but let's not jump to conclusions. We'll need to do some tests to get a better understanding of what's going on. I recommend a chest X-ray, sputum tests, and possibly some blood work. This will help us determine the exact cause of your symptoms and decide on the best course of action.
All right, let's do it. I just want to get this sorted out.
This is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer, A, B or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Question 25. You hear a nurse briefing her colleague about a patient. Now read the question.
Mrs. Kelly admitted to hospital and underwent biopsies after being told that lumps had been discovered in both right and left breasts. She was diagnosed with right breast cancer following histological studies. She has been hospitalized now and scheduled to undergo surgery. She was prescribed with Tegaderm for her pain, however, she developed with a rash following the administration of it, and it was discontinued, and matter has been brought to the attention of treating consultant. Her assessment is within normal limits. Her vital signs are normal. She is with her husband resting in her bed. Around 8:30 I gave her 2 paracetamol. She's got normal saline at 10 mL per hour.
Question 26. You hear the manager of Operation Theater talking to the OT staff. Now read the question.
Medical errors are the main cause of increased hospital-associated mortality and morbidity. Operation theater setting is very complex and it results in situations which can easily lead to different types of errors. Countless medical mistakes could occur in an operating room, such as administering the wrong medication, wrong site surgery, equipment failure, inadequate use of equipment, incorrect anesthesia dosage, foreign objects left inside patient's body and many more. Now, in our hospital, it's good to see how diligently you all are following guidelines and standards to prevent errors in the operating room. However, the surveys we've done sheds light on nature of errors occurred in the past few months. It is apparent that out of 3 errors, 2 of them were related to missing swabs while scrub nurse was numbering before closing the site. It resulted in extension of surgery time and apprehension among staff.
Question 27. You hear the manager of a care home for the elderly talking to the nursing staff. Now read the question.
I would like to congratulate all of you for your commitment to providing quality care for our residents. It's great to see how you all adhere to our policies and procedures regarding various aspects of patient care. Now, I would like to draw your attention to a national-level report on increased outbreak of norovirus in healthcare facilities, which states an increase in the number of cases by 40% confirmed by lab tests. Taking this into account, it is crucial that all staff members must strictly follow hand hygiene, especially catering staff, educate visitors, look out for signs and symptoms among residents, avoid exposure to vomiters or diarrhea. In case of positive cases, isolate them. I hope we will be able to navigate this difficult situation with our commitment. We should also accommodate complex care needs of our residents.
Question 28. You hear part of a morning briefing on a hospital ward. Now read the question.
Right, so overnight admissions to the ward. George, could you start us off?
Sure. We have Richard Webber in bed 8. He's a 56-year-old male who was brought into the emergency department by ambulance. He has a history of poorly controlled hypertension and type 2 diabetes. He presents with retrosternal chest pain radiating to left arm. He's to remain in coronary care unit until the stabilization of his symptoms. He'll be undergoing angiogram at the earliest. His BMI is in morbid obese category and he requires dietitian input about his food habits.
Okay. I'll review about dietitian consultation later once his condition stabilizes. Now what's the plan for discharge?
Social work interventions required for placement and community support options, and that's been booked for tomorrow. Also an application for the community nurse care may be required.
Right. We'll consider that at tomorrow's ward round.
Question 29. You hear a trainee doctor telling his mentor about an issue he faced while doing a procedure. Now read the question.
So, how was the day, Jack?
Well, I'm afraid I had a problem while catheterizing Mr. Peter. I've done that procedure many times now, so I wasn't particularly concerned. What I hadn't expected was the impact of patients' reaction to the procedure. I tried explaining about the procedure in detail beforehand. I am not sure whether I didn't do a good job there. I'm afraid I might have used a lot of technical terms.
Well, that can happen. One doesn't consider the patient's non-healthcare background. One must always think that they know nothing about medical terms.
Yes, in this case, he was very apprehensive and didn't allow me to complete the procedure, despite the enduring discomfort from urinary retention.
Well, I'll reattempt the procedure.
Question 30. You hear an orthopedic doctor talking to a patient who has pain in right foot. Now read the question.
I'm here because I've had this intense pain in my right foot for the past 6 hours.
Okay, and was there any trauma to the foot or anything happen within the last day?
No trauma.
Is there anything that makes it worse, like putting socks on or even having clothing touch it or your shoes touch it? Or any movements?
Yeah, I guess yeah, my shoes touching it hurts.
How would you describe the severity of this pain? 1 being the least pain and 10 being the worst pain you've ever felt.
I say it's like an 8.
That is the end of Part B. Now look at Part C. That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear an interview with Dr. Burton regarding medical errors in mental health practices. You now have 90 seconds to read questions 31 to 36.
I am joined today by Dr. Burton, psychiatrist and researcher, who practices in mental health care facilities. Dr. Burton, what you would like to say about medical errors in mental health care?
First of all, there is need to understand medical errors in general and its implications. In simple words, it refers to mistakes made by health professionals that can result in harm to patients. These errors can occur at any stage of care, from diagnosis and treatment to medication administration and follow-up care. Medical errors have several causes, mainly disregarding guidelines and protocols of safety, failures in the dissemination of drug knowledge and inadequate availability of patient information, unavailability of equipment, production pressure and hectic schedules, and physician fatigue. These errors are capable of leading a medical liability. Now, one gets to hear news very frequently about lawsuits filed against providers in relation to surgery and general care. However, it is not common to come across such news in terms of mental health care. It may be that there are less occurrences of errors while caring for mental health patients, or as it seems more likely public awareness about nature of errors in mental health setup is limited.
What are some common types of medical errors in mental health settings?
The chances of medical errors in psychiatric settings is as equal as any other medical specialty. In mental health setup, one can witness misdiagnosis, medication errors, failure to detect underlying medical conditions, and breaches of confidentiality while working with psychiatric patients. Misdiagnosis can lead to inappropriate treatment, while medication errors can cause adverse reactions or interactions. Failure to detect medical conditions can result in untreated health issues, and breaches of confidentiality can harm patient trust and privacy. It is significant to understand the nature of errors if any effort towards preventing it is to be successful.
Doctor, how do these errors impact patients?
It is possible that patients may experience physical harm, emotional distress, and a loss of trust in their healthcare providers when the errors aren't grave enough. I would like to talk about a patient named George who was diagnosed with depression and commenced with antidepressants, a type called tricyclic antidepressants. The prescribing doctor didn't make efforts to collect comprehensive patient history, which resulted in missing George's history with heart disease, particularly pre-existing bundle branch disease. Unfortunately, George died due to heart attack caused by heart block, which was later attributed to the new medication he was prescribed for depression. This can be used to make a compelling argument that medical errors in mental health care is no less a threat.
Why there is lack of awareness about errors in psychiatric settings?
Well, to understand this we need to consider broader aspects of mental health care, including its historical evolution. For most part of the past, psychiatric illnesses was stigmatized, and people didn't come forward to recognize and seek care. However, there is gradual trend where masses are starting to pay attention to mental health issues, albeit their lack of understanding of nature of mental health issues and their treatment makes them to be innocent in finding misdiagnosis, wrong prescriptions and other forms of errors in the treatment. Therefore, as awareness about psychiatric illnesses continues to improve, so does errors related to it.
What are the implications of medical errors for mental health professionals?
Yes, medical errors are a distressing event to the patient as well as healthcare providers. The impact of such errors has been well studied on patients but poorly on health professionals. These events are still considered as a taboo in the medical culture and hence missed as great learning opportunities. They have negative impact on doctors' emotional well-being, general quality of life, and their professional practice and conduct. On top of that, it invites legal trouble. If there is malpractice claims initiated, it may result in financial burden on the healthcare organization. It is high time healthcare administrators start to consider and treat doctors involved as second victims.
Now, what do you think can be done to prevent errors?
First, do no harm is the most fundamental principle of any healthcare service. No one should be harmed in healthcare. However, there is compelling evidence of a huge burden of avoidable patient harm globally across the developed and developing healthcare systems. Most of the mistakes that lead to harm do not occur as a result of the practices of one or a group of health and care workers, but are rather due to system or process failures that lead these health and care workers to make mistakes. Understanding the underlying causes of errors in medical care thus requires shifting from the traditional blaming approach to a more system-based thinking. In this, errors are attributed to poorly designed system structures and processes, and the human nature of all those working in healthcare facilities under a considerable amount of stress in complex and quickly changing environments is recognized. This is done without overlooking negligence or misbehavior from those providing care that leads to substandard medical management.
Now look at Extract 2. Extract 2. You hear a presentation by a physiotherapist on using continuous passive motion machine in post-knee replacement patients. You now have 90 seconds to read questions 37 to 42.
Hi, I am Andrea, physiotherapist working in the hospital. Today, I will be delving into different aspects of using continuous passive motion machine known as CPM machine. First of all, let us understand about the machine. CPM machines are devices that move a joint continuously through a controlled range of motion. They are commonly used after knee replacement surgery to facilitate early mobilization and improve recovery outcomes. The machine consists of a motorized frame that moves the leg, gradually increasing the range of motion as tolerated by the patient. The primary goals of using CPM machines are to prevent joint stiffness, reduce swelling, and accelerate the recovery process by maintaining the joint's mobility and promoting tissue healing. You may wonder whether everyone after knee surgery requires it. Well, not necessarily. Now, it may not be the case that everyone benefits from the use of this machine. Being said that it is the responsibility of the physical therapist to consider each individual case thoroughly before determining the need for CPM machine. A physical therapist evaluates the person who needs physical therapy and creates a plan of care. This plan includes a recommended number of sessions, treatment types, and treatment goals, use of any special devices. Along with medical factors, it is wise to take into account financial implications for the patient. Many health insurance providers cover the cost of the treatment with CPM machine. If treatment cost comes from out of pocket, chances are high it will be a burden on the patient and their family. Moving on, I would like to talk about a patient called Weber, a 75-year-old who was in our department following right knee replacement. His surgery was uneventful, and he was started with physical therapy from second postoperative day. Concerned therapist decided to utilize CPM machine to help him recover fast. Just at the first session while using the machine, it turned out to be a disaster. Because of obtrusive nature of the device, constant noise produced by it as well as the new environment made it difficult for Weber to cope as he was suffering from dementia which altered his cognitive abilities, judgment, reaction, and mood. This case emphasizes the need to consider thorough patient history in decision-making about using treatment modalities, especially in elderly patients. Next, we have the case of Mrs. Rayner, a 62-year-old woman who underwent total knee arthroplasty on her left knee. Unlike Weber, Rayner's preoperative evaluation revealed no significant cognitive impairments. Her initial postoperative days were marked by moderate pain and swelling, but her overall recovery was progressing as expected. Her physical therapist decided to implement CPM therapy to help manage her knee stiffness and improve her range of motion. Rayner responded well to the CPM machine, which allowed her to gradually increase her knee flexion without experiencing significant discomfort. By the end of her hospital stay, her range of motion had improved, and she reported less pain and swelling. This positive outcome demonstrates that for the right patient, CPM machines can significantly contribute to the recovery process by promoting mobility and reducing postoperative complications. Our third case involves Mr. Campbell, a 70-year-old man who underwent bilateral knee replacement surgery. He was generally healthy with no major cognitive issues, but he had a history of rheumatoid arthritis, which added a layer of complexity to his recovery. The physical therapist initially opted to use CPM machines on both knees to ensure consistent mobilization and to mitigate the risk of stiffness. However, Campbell found it challenging to tolerate the CPM machines due to the discomfort and noise, which affected his sleep and overall well-being. After evaluating his progress and considering his feedback, the therapist decided to discontinue the CPM therapy and instead focused on manual physical therapy techniques and other supportive measures. This case highlights the importance of being flexible and patient-centered in the approach to rehabilitation, as not all patients will respond favorably to the same treatment modalities. In conclusion, while CPM machines can be beneficial in postoperative rehabilitation for knee replacement patients, their use must be carefully considered on a case-by-case basis. Thorough patient evaluation, including cognitive status, medical history, and personal preferences, is essential in determining the appropriateness of CPM therapy. Moreover, continuous monitoring and adjustment of the treatment plan based on the patient's response and feedback are crucial for achieving the best outcomes. By taking a holistic and individualized approach to rehabilitation, physical therapists can help patients achieve optimal recovery while minimizing potential challenges and complications.
That is the end of Part C. You now have 2 minutes to check your answers.